Welcome to the Uncommon Sense Podcast. I'm Jay Howard, The Rock, here with Big Brother Mo Better J. Michael B. Wright Senior. Michael B., how you doing, man?
Oh man, now I'm on the air with the one and only James Howard Green the second. Man, I'm doing all right there. Stillman College player.
Yes, sir. Yes, sir. Yes, sir. Uncommon Sense Podcast. This is when we're exploring the edges of reason to
Mm,
bring you the truth because the truth will make you free, brother.
all day long player.
All day long.
That's
All
what the
day long.
boss man said. That's what he said now.
That's what he said, didn't he? That's what he said.
That's what he said now.
Man,
Yes, sir.
brother, there's so much craziness going on in this world.
Yeah, I was gonna tell you, man. I already got my plane ticket to Guyana. Oh yeah. What's up with the bear?
Give me that, give me
I'm trying to
that.
tell you, boy, you better learn some Sudanese or some goddamn Zulu or some
Zulu or something in that
Swahili,
nature, right?
something, brother. We got to go back to the motherland, player.
We got to go back, Doc. We got to go back. We got to go back.
I can't do this. Yeah,
Mm-mm.
man.
But tonight, brother,
Yes, sir.
we gonna edge it down to about two topics because
All right.
these some heavy topics
What on?
that we got going on here. You know, Trump and them, they doing their thing. They gonna continue to do their thing
They got 2 more
because of
years.
who they are.
Yeah, they got 2 more years, player.
They got 2 more years.
Whew,
2 more. Oh Lord, have mercy
I'm
on
trying
us.
to tell you.
Yes, sir.
Yeah, man.
Mm-hmm. So the very first topic we gonna hit is healthcare, my brother.
Yes, sir. That part.
Man, with this healthcare, man, when you run the beautiful beam footage down, brother,
Mm,
and we did something a little different than everybody else would.
mm.
Usually people go to the people who can't, who that can't afford the health care, things of that
Right,
nature.
right,
But
right,
this
right.
time let's reverse it and let's go to the doctors
Mm,
who's supposed to be able to afford the health care.
hmm.
They supposed to know the system, but even they struggle through the system.
What you say,
So if they struggle through the system, what you think we gonna do?
boy?
Boy, let me
There's
tell you.
no rest for the weary.
No rest for the weary, doc.
Yeah, buddy.
Here's two doctors
Yes, sir.
that's struggling with that, and one happened to need a he's going through cancer, and his wife is a
Mm,
doctor, and she's trying to help him, and he's known to help patients to get through, the insurance red tape and things of that nature. But when it
right.
came to himself, my
Mm,
my, here we go with the beautiful beam footage right here on Uncommon Sense.
my,
It
my.
was heartbreaking and it was awful.
Tracy Hurley says watching her husband battle cancer in late 2021 was harrowing.
I lived in fear every day.
A battle made worse, she says, because so many of the skirmishes were with their insurance company.
No family should have to go through having to fight to get treatment as recommended by their physician covered while fighting for their lives.
Is that what Dan was doing?
Yes.
Millions of Americans say they are struggling to get medical care, either unable to pay sky-high deductibles or, like Dan Hurley, denied coverage for tests and treatment by health insurance companies.
If we as two physicians had to struggle the amount that we had to struggle to get care approved, what about people who do not have medical knowledge? What's happening to them every day?
Not only are both the Hurleys doctors, Dan, an ear, nose, and throat surgeon, was also skilled in cutting through insurance red tape for his patients.
And yet we still ran into issues a lot.
Dan was an avid hiker until a nagging backache turned out to be cancer.
Diagnosis was chondrosarcoma, which is a ultra rare bone tumor.
To try to save his life, the tumor, along with Dan's hip, had to be removed. Insurance only covered a portion of the costs.
Many of his treatments were denied. We had PET scans, we had CT scans denied, we had chemotherapy, we had radiation, we had certain medications that required prior authorization and were denied.
Now, this man had cancer. How do you, as the insurance company, deny him to get the treatment that he needs for the cancer? You're on mute, bro.
Why you put me on mute, man?
I didn't do that. You did
I know, man. Gotta be quicker than that, player.
I
Yeah,
know.
man. I know. Yeah, man. It's all about them greenbacks, man. At the end of the day, that's the whole point. When for profit moved in, and just like they did everything else, man, they picked apart as far as how you can monetize each piece, and here you go. I mean, this is your healthcare in America, man.
But right, these are two doctors
Yeah,
that deal with the insurance companies on a regular basis,
right.
even for their patients.
Yes, sir.
And they're getting turned down
Hmm.
because of cancer.
Yes, sir.
That this man needs cancer in order to, he needs the treatments in order to survive.
Mhm. Yes, sir. Well, again, just like with all for profits, man, is about the shareholders. When you have individuals that again are concerned about profits for shareholders, then the
Mhm.
patients is just collateral damage, and so that's where you are. They're looking at bottom line, man. I mean, you
Right,
become a figure on a piece of paper.
right, right.
That's I hate to say it, man. I don't care what That's the problem with money. It doesn't discriminate. No,
You're
well,
right.
it don't discriminate, man. And
You're
so
right.
it doesn't care which pedigree you came from. You still fall in the same category, which is how much money can we save by not doing what we know we need to do. But if it's going to cost us more to try to keep you alive, then let's just go ahead and let nature take its course.
Mm. Wow.
I hate to say it, man, but that's what we are in this country, man.
Now let's go to the beautiful beam footage again,
Hmm.
where we're going to really break down the healthcare business, how the business end is from the insurance company.
Yeah.
Because see, the insurance company has one mindset: the less that you use them, the more money they make.
Hmm.
So here we go.
Health insurance companies know that 5% of their members account for 50% of all the cost. So I have this huge financial incentive to make their lives as difficult as possible.
Ron Halrigan, now a consultant, spent 2 decades working for health insurance companies and says the business model is unlike other industries.
The more your customers use your product, the less money you make. Your incentive is to keep them from using your product.
How often do insurance companies refuse to cover the cost of medical treatments? Well, it's hard to tell. Health insurance companies are only required to report denial data for plans purchased through healthcare.gov. A CBS News analysis of about 1.3 billion federal health insurance claims across 3 years shows that in 2024, insurers denied 19% of in-network claims. But for the biggest insurer, UnitedHealth, that was a steep drop from the preceding 2 years, when it denied as many as 1/3 of its federal claims. While it did not provide data to support it, UnitedHealthcare says that across all its plans, their initial denial rate is 10%. They also point out that when employers are self-insured, the plans they choose for their employees dictate coverage decisions.
So in other words, since they only have to report to the .gov,
Hmm.
right?
Yes, sir. Hmm.
There could be many more um, people getting declined for
Oh,
healthcare.
oh, you know it is, man. You know it is.
Mm.
Uh, to be honest, man, I have a situation that right now with a member.
Excuse me. Yeah.
Matter of fact, he is a veteran, former
Hmm.
military,
Hmm.
and because of income brackets and stuff like that, and because he quote unquote didn't serve during wartime per se,
Mm.
they are denying certain benefits toward him because again they said you have
Wow.
to be at a certain da 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 da.
Hmm.
So it's all these hurdles that a person's got to jump through. And again, if you're not savvy and if you're not aggressively uh, making these things that hold folks accountable, yeah, you can slip through the cracks real quick. And like you're saying, since they don't report beyond the healthcare.gov, then you're probably up there to probably 45, 50%. If you really begin to dictate and
Right,
look at
right.
who's getting denied, da, it's bigger than 19%. You can be guaranteed that,
And bruh, I was talking with someone earlier this week, and I
man.
didn't know we was gonna do the show on this,
Hmm.
but as they had a procedure, and the procedure, of course, they would have to go into them or whatever.
Hmm.
Do you know they declined them to even have the to put them to sleep? They declined that part of it.
You decline anesthesia.
No, the insurance company declined
I know what I'm saying.
anesthesia.
They
Yeah,
decline
yes,
anesthesia.
but still did the procedure.
Wait. So they didn't put the baby to sleep?
No,
Oh hell no, shout.
no, child. I would have got up right there like, no, no, no,
Hell
no,
no,
we're not
shout. Wait a
doing
minute.
that. Oh,
How
hell
you
no.
gonna perform procedure with no anesthesia?
Exactly.
You know what?
Exactly.
All right, I'm done.
See, that's how
And
deep this thing is right here.
good night. Yeah, man. See somebody that I
See,
will put down
somebody,
with them.
man, somebody gonna get hurt.
Man, I would do it myself.
Yeah, yeah.
Just give me the needle. I'll shoot myself up, goddamn.
Exactly. Exactly.
Um, but that honestly, see, that's the thing, Jay. Because again, when you really begin to start looking at how people are affected,
Mhm.
that's just that right there, as far as
Right.
denying a particular thing. And you still got to have a procedure,
Right.
but we're gonna tell you what you can and cannot have during the procedure. Okay. So I
But
mean,
anesthesia is like the standard.
it is a necessity. if somebody gonna cut,
Exactly.
yeah, if somebody gonna cut your tail open, yeah.
Exactly. You
But
just
again,
gonna sit there and just
yeah, I don't know.
no,
I don't see how.
no.
But again, man, this is where you are. This is where you are in this country.
Yeah.
And again, when you have full profit, that's what
Hmm.
this is.
Hmm.
When you have for profit entities governing this thing, they're
Right.
not looking at standard of care.
No.
Most of these cats are not medical doctors, and if they are,
Hmm.
they're so far removed from the spectrum, it doesn't matter at this point.
Right.
But so it's a dynamic of you have individuals who are not medical professionals who are making
Mhm.
decisions about medical
Exactly.
procedures, by which you don't have the wherewithal to know what is a necessity and what's not. You're making it based on what the figures are saying, telling you.
Exactly. Exactly. Now you also got the doctors. The
Hmm.
doctors are catching it with the insurance company
Hmm.
because, like you said, you don't have with the insurance company, you don't have the medical professionals
Hmm.
that are making the decisions. They just looking at the bottom line and said, no, we ain't gonna cover that.
That's it.
Yeah.
That's it. It's all clerical, and that's what. Now some say they got a medical review board. Da. Yeah, go try that one.
Yeah, go
Hey,
figure.
they work. Yeah, they go work for the company, and you gonna call them a medical
Exactly.
review? Yeah, okay.
Come on now.
So, so
Mm.
you know where they went with that one.
Right.
But
Right.
it's a travesty, man. When you are really looking at these situations, and a lot of, just like all of us, man, we pay
Mhm.
for this stuff, And
Right.
I mean, you're talking about months and months and years where you might not ever make not one claim
Right.
on your insurance. And then all of a sudden you have this one episode that requires you to have it. And all that money you paid into it, all the money they've made out for you every single month, every
Mhm.
single year by interest and whatnot, that you
Mhm.
never made a claim.
Right.
And now that you need to come due, they
Mhm.
want to now dictate to you what you can and cannot get
Mhm.
out of it.
Right.
So yeah, honestly, man, all of us, I heard you say, Jerry, you say this,
Mm.
you're one sickness from bankruptcy,
Yeah, you are.
and that man wasn't lying. He
That
was not
man
lying
was
at all.
not lying, brother.
He wasn't lying.
Was
You're
not lying.
one sickness away from bankruptcy because all of us, man, you can't afford to get sick.
Right.
You honestly cannot afford to get sick in America.
Yeah. Exactly. Exactly. Now here's a doctor right here that has a practice,
Hmm.
and this doctor said it's more difficult to stay healthy in America.
You think?
The doctor says this. Yeah, you think.
You
Right.
think? Okay.
All right.
Hmm.
Here's the beautiful beam footage on this one.
Companies have honestly made it more difficult to be healthy in the United States. This is a surgery center really built for patients affected by breast cancer.
Dr. Elizabeth Potter is a surgeon who sees as many as 60 patients with breast cancer each week at her Red Bud Surgery Center in Austin, Texas. She says insurance denials actually add to costs.
I have 2 employees who spend almost all day navigating insurance. It seems that Everywhere we turn, there's an issue, whether it's an insurance company saying, we won't cover your surgery at that surgery center, or we won't pay for that medication. We want you to be on a different medication.
All right, here we go. All right, let's do this.
Case in point, on an early morning this past fall, Jeannie Lee, a 40-year-old mother with breast cancer, was being prepped for a procedure that could have been done 2 weeks earlier during her double mastectomy. But both her and her husband's insurance companies refused to cover the cost.
Today I'm having a lymphovenous bypass.
Lee is at high risk for developing a condition known as lymphedema.
I mean, it becomes very difficult to just use your arm. It can be painful, it's swollen, it's also deforming.
I'm 40 years old, I have 3 young kids. It's very necessary to do this procedure.
Once Lee was able to obtain financial assistance through a new nonprofit set up by Dr. Potter, she was back in surgery.
This patient is having an extra surgery, a separate general anesthetic, because her insurance company wouldn't cover the surgery. We could have done this very easily at the same time.
When she isn't in surgery, Dr. Potter is often on the phone,
Probably insurance.
defending her treatment decisions to insurance company medical directors who she says often know little about her area of medicine.
Now there she goes. She got to negotiate with the insurance company to have a procedure done for their client. Man, let me unmute you. Go ahead and talk.
You know. Hey, man, let me tell you
Yeah,
something.
man. What you doing,
You
man?
do not be muting me over here
I
on
didn't do
this
that.
side.
You did it
I
yourself,
know
player.
about, man. I pushed the button. I ain't gonna lie.
Push the button,
Yeah,
boy.
I pushed the button. I know, right? But like Doc was saying, man, she is trying to navigate those waters, man, with individuals who don't have a clue as it relates to what she's doing.
Right.
And that's the difficult thing when you're trying to explain to someone who does not have the vocabulary
No.
nor the skill to
Right.
dissect what you're talking about. And so you're there. So I'm very concerned, man, as it relates to where you're going in the coming years, because
Right.
at this point, when you become just a figure on a piece of paper, then what can you do? And when professionals who are in charge of your care are catching as much hell as you do as a patient,
Exactly.
what does that tell you, man?
What does that tell you, brother?
What does that tell you?
That is crazy. That is crazy. And then Doc goes into how she tries to take care of the patients, right? But in her trying to take care of the patients, like you were saying, she's on the phone with somebody that has no kind of medical knowledge. All it is about the nickel and dime. That's it.
Right. Right.
Sometimes I get,
And like she
an
was saying,
ophthalmologist,
An eye doctor.
an eye doctor. It was just completely absurd. You won't give me your name or number, and neither will the doctor from Texas. Okay.
Dr. Potter sometimes posts her side of those conversations online.
Okay, so we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct?
Insurance just keeps getting worse.
But a video she posted in early January 2025, she says, ended up putting her entire medical practice at risk.
I got a phone call.
While she was in the operating room, Dr. Potter says she got a call from UnitedHealth Group.
It's never happened before. I didn't know what was going on, but they said it was urgent and I needed to call. And so I did.
That urgent call, she says, was to question why her patient needed an overnight stay in the hospital.
I am operating. I'm doing the right thing for the patient. I'm going to keep her overnight. I walked out of the hospital and I just filmed myself in my unfiltered, moment.
It's out of control. Insurance is out of control.
Shortly after she posted that video, she got a letter from the insurance company threatening to sue her for defamation.
I'm taking great care of patients. They're just trying to scare me into
weren't
being
you
quiet.
scared?
I was scared.
UnitedHealth Group has not taken Dr. Potter to court. They declined an on-camera interview, but a company spokesperson says the call was due to an erroneous order, and a doctor would never be asked to leave surgery for a call about an insurance matter.
Really? And I wouldn't have been scared. I was like, come on. If you want to come on. Come on, make my day.
I know, right? Yeah,
Right.
yeah, that's the whole thing, man. But they gotta. Have you seen their legal department,
I,
man?
I know, bro. I know, bro. I know.
Man. So
But then
yeah,
again, when you break down their other departments, it's like, okay,
yeah,
you
yeah.
know, they talking to me about ear and
Mhm.
nose, and we talking about cancer.
I told you, man. That's what you got.
Mm,
And so again, when these individuals who are in their profession, but when you're hired by the company to ensure that the company makes
mhm.
profit,
Right.
then tell me just how unbiased you can be.
Right. Mm,
You know what I'm saying?
right.
If this is your task with ensuring that your corporation does not pay more than it possibly can,
Hmm.
then my question is how unbiased can you be?
Right.
That this is
Exactly. You
oxymoron.
can't.
You can't,
No.
and so that's again, you're painting folks into a box. And if you're not savvy, and this goes back to not being aggressive, getting care for patients.
Hmm.
If you're not savvy in this stuff, man, they know they can wait your tail out.
Right. Right.
You know,
Right.
the young lady needed procedure. They said she could have had 2 weeks ago. Waited 2 weeks to get thing done. Anything can happen when you got cancer, man. Especially that stuff is aggressive. You don't
Yes.
know how fast that stuff will take over your body in 2 weeks. You don't
That's
know the
right.
damage that's done in the waiting process. And so just like they did the Tulsa massacre, you waited till all the survivors are dead, and
Mm.
okay, that,
Okay.
that's
Yeah.
that's how this thing works, man. They
Yeah.
know they got time on their hand, and they have no problem playing the wait game.
But see, this is the thing, right?
Yes, sir.
They've done studies that say that once a person gets declined, right,
Hmm.
people will not fight the decline. They
No.
just let it go. They
Yes.
said only 1%,
Hmm.
1%
Hmm.
will fight the decline.
Right.
So if only 1% will fight the decline, you mean 99% of the other ones,
Hmm.
they just accept what they say and that's it.
That's it.
Yeah. But
Because
now tonight, what we gonna tell you,
it's how to fight,
no,
goddamn.
you fight that. You fight that. You
Yeah.
fight that with tooth and nails because see, they're
Hmm.
looking for you not to do it.
Hmm. Hmm.
But when you do it, it's like, oh, they gonna okay, well, let's see what we can do now.
That's it.
Yeah,
That's it. You got to be consumer smart, and the thing about it again with social media, to some degree, has been our greatest downfall.
you're right.
Uh, in so many
Right.
ways,
So
man.
many ways.
So
Yeah.
many ways, and so the average person, unfortunately, is not consumer smart. Like you're saying, only 1% will contest something and appeal something. All right, so the 99, either you don't have the wherewithal, or you don't have the astuteness, or I hate to say this, but the concern for yourself to push something that you're paying for.
Right.
The
Exactly.
kind of money that we shell out every single month for insurance, what? You know,
What? Man, yeah.
what?
That right
So
there.
they're right there. So that's the whole thing, man. But in a society where people rely on the experts and stuff like that to tell you what you really need, and that's
Mm-mm.
elective surgery and all that stuff. When you rely on somebody else behind a door to tell you that stuff, and that you don't do your own research and concern about things,
Yes, sir.
then yeah, you become very passive in your own particular plight on this planet. And some people, Jay, they get to a point where they feel helpless. How do you go up against the United Healthcare? How do
Right.
you go up against Aetna?
Mm.
And that's
Yeah.
how most people feel. They see
Right.
these juggernauts, and they're like, it's not even worth it. Well, that's not the case when it's your health on the line.
Right. Right.
So you got to be consumer smart.
Boy,
And
you better learn how to fight that Goliath. You better go on now.
you
Let's
better
go.
find some smooth stones somewhere and throw them.
There you go, brother. There you go. There you go.
Boy, chunk that sucker, as my mama say, chunk them rocks.
Chunk them. Chunk them.
Chunk them, boy. Chunk it.
But again, appeal your denials, and here's the beautiful beam footage on that.
Yeah.
All of us are vulnerable to being denied. Not all of us can weather the storm as easily when it comes to appealing and overcoming these barriers.
Miranda Yaver, an assistant professor at the University of Pittsburgh, says insurance companies know that only a small percentage of people will actually appeal claim denials. She calls it rationing by inconvenience.
A lot of people don't know that they even can appeal.
So you're saying that it's not really the denial that ends up keeping people from getting care, it's that the people give up?
And fewer than 1% of those claim denials result in appeal, even though people are winning roughly half the time.
Clearly, it does pay to appeal, but some patients, like Dr. Dan Hurley, fighting an aggressive cancer, run out of time. Much of his last months were spent, says his wife, on the phone with insurance company personnel.
He would go line by line with them and they'd say, okay, yeah, we need to get a supervisor involved. We'll call you back. And then they don't.
Dan's goal, she says, was to see insurance companies held to a standard similar to doctors, making them liable for malpractice when they deny life-saving care.
The act of signing that denial is practicing medicine. The same way if a patient came to me and I made a decision about treatment and that decision went sideways, I'm liable. That's how it works.
Dan Hurley died on August 3rd, 2023. 1 week later, his wife got a letter from the insurance company asking her to pay for a round of chemotherapy that had been pre-authorized but was suddenly retroactively denied. What kind of money are we talking about?
$80,000. It was such a gut punch to get it that day. This is unbelievable, right? Almost laughable.
Dan Hurley's battle has become his widow's.
There's part of me that says, oh, he would be so proud of me. But there's also part of me that he'd be like, come on, chop, chop, you got this. Let's go. Pick it up. Don't be sad. Keep going. Because that's what he was like.
How you gonna retroactively decline the man after you approved it?
Because they got the power of the pen. That's
Wow.
Now if that don't tell you hard, I don't know what does.
It does, bro.
You
It
know,
does.
it does. So the last days of that man's life was fighting with someone that he's been paying probably God knows how much insurance money for premiums,
Right.
and they gonna hold your life in hock like that.
And then, of course, he was a professional in the field.
That's a double whammy, man. That makes it all worse, man. And but again, this is where we are. And what I would honestly love to see, man, is these
Hmm.
retired physicians,
Hmm.
just like retired educators,
Yes.
those who know these things and in this space, and also have the intelligence to articulate these problems. These are the ones, man, that need to be in the forefront.
Right.
These are the
Right.
cats that need to be in the
Right.
CDC, and
Right.
and, and
Right.
then they're not Robert. Anyway, so, yeah, I ain't gonna get started. That cat just need. But anyway, so
Yeah.
that's where we're in, man. When you have these individuals, such as that have the knowledge in this space, man, they need to be in the forefront. And that's what I'm praying, really, that those individuals get that second win. The retirees, whether it's education, medicine, you name, pick a field. Um, and get back in the game and correct this shift, because if not, you got these young yuppies. Only they're concerned about, man, is the bottom line. They're not
Right. Right.
they're not thinking beyond that, man.
Right.
Just as long as I get my 6-figure check, I'm good.
And like the doctor said, you need to hold them accountable just as they hold the doctors accountable,
Hmm?
especially when it comes to life-saving treatment.
Exactly, because they are
Right.
practicing medicine. They're
Exactly.
literally they're telling you what you can and cannot have, and
Right.
that is practicing medicine.
Exactly.
Um, and so again, it's the lingo, man. It's literally in how you say something to folks on the other side of that phone. I think that was a blessing of me being licensed in PNC and
Hmm.
life
Hmm.
insurance, stuff like that, because then
Hmm.
you do learn the lingo of that field.
Yes.
And I've noticed when you can talk that kind of talk, you know what I'm saying?
Hmm.
People kind of get back over you. You like,
Yeah, yeah.
yeah,
Like, oh, okay, you know a little something,
yeah,
huh?
you know,
Yeah,
or something. So
yeah.
that's it. But again, a lot of folks are not privy, to go through that thing, and everybody's trek is different.
Right,
But
right.
when you do know how to speak that lingo, man, when you can say certain things, like
Yes.
when you drop the insurance commissioner and
Hmm.
certain numbers, and they're like,
Right.
huh? Yeah, and then the
Okay,
whole
let's see what we
conversation
can do
changed.
now.
That right there,
Yeah,
you
yeah, yeah,
get a whole different person on their phone when
yeah.
you kind of like can
Exactly.
articulate, the lingo. So that's, but again, this is where the retirees come in. This is people who
Hmm.
are in that leg where they can give back to that space.
Right.
And I really do pray, man, that folks who are in that space, who have
Mhm.
hopefully have the leisure time,
That's right.
can at least get in there and again shift some things. Because if it's not brought out, if it's not articulated correctly, then it just becomes a sound bite, and we move on to the next problem.
Mm.
There's no way you're gonna fix things like that.
Right, right, right. So let's kind of shift it a little bit. We still with
Okay.
healthcare. We're gonna shift it a
Mm,
little bit,
just a
and
little.
we're gonna kind of shift how really a hospital is broke down,
Mm, mm,
and how you break a hospital down when you're looking at profits and margins and things of
yeah,
that nature.
yeah.
Because see, back in the '60s, the hospitals were pretty much run by nonprofits, donations. Also, that's where
Mhm.
Medicare and Medicaid come in at,
Mhm.
because of the older generation didn't have insurance, so they just wanted to make sure that they had insurance and made sure that the hospitals were getting paid.
Mhm.
But then as time went by, then it starts going to the private sector,
Mhm.
and then the private sector, the I guess the model they followed, the business model they followed, was actually KFC,
Mm,
chicken.
yeah.
And they said, okay, we're gonna build the hospital model the same way.
That's about right.
So let's look how they break down a hospital on a
Mhm.
business side. And then
Mhm.
you see why you see certain things in a hospital.
That part.
Mm.
Most people think of hospitals as scary, depressing places. But in a lot of ways, they're complete miracles. Over here, this part of the hospital, this is where anyone in the area can walk in. And a team of unbelievably trained professionals rushes to their aid. That's the emergency room. And over here, we've got the operating rooms, the surgery suites. And over here, cardiology. If someone's heart literally stops working, the people in this room bring it back to life. All of this matters. All of this is incredible. But when you look at a hospital like this, it all just looks like rooms. So now, let me color the rooms red and green. Green for profitable, red for money losing. Look at that. The emergency room, constantly losing money. The place where people are born, deep in the red. Psychiatric units, total money losers. But the spine surgeries, the orthopedic procedures, the cardiology wing, those make a ton of money. But if you're the kind of person who made a lot of money introducing the world to KFC, it's pretty obvious the changes you would make to make hospitals more profitable. Community programs, gone. Maternity wards, gone. Psychiatric units, gone. Even pediatrics, gone. The emergency room? Well, you'd love to get rid of that. But federal law says you can't if you accept Medicare. And speaking of Medicaid and Medicare, these programs usually pay less than the care costs. So the other smart move, if you're a profit-maximizing hospital owner, is to make sure that your hospital is in a community where most of the patients are paying with private insurance.
That's
Daddy.
how it's broken down.
That is right there, man.
That's how it's broken down right there. You
That is.
don't see your community quote unquote centers in there anymore.
No. Ooh.
You don't see, your maternity wards anymore per se, because as soon as they happen, they got to go.
They got to go.
They got to go.
You got to go,
Ain't
boy.
no more staying in the hospital for a week.
No. One day, man.
No, one day,
One day. That's all you got.
one day, unless
Yeah.
complications occur.
Right there.
Yeah, yeah,
And
yeah,
they send you home and they keep the baby.
yeah. Hmm.
They send you
We'll
home,
send the
keep the
baby
baby.
later.
Yeah, I'm trying to tell you what. But that's That's how they do it, man. And so yeah, you can see, and now they got this thing called urgent care.
Mm.
That's
Yeah.
so yeah.
Uh-huh.
So
Yeah,
that's
urgent already.
yeah, it's urgent, all right.
Mm-hmm.
So this is where you're moving, and so yeah, the model they took, like I said, take incarceration, they did the same thing.
Yep.
Medical did the same thing.
Yep.
Education, they did the same
Did the
thing.
same thing. Right.
So it's
Yeah.
horse of the same color, man. Just roll a different way.
But see, right, this is true.
Hmm.
And then you got to ask a question though. How can a closed hospital
Mhm.
make millions of dollars for CEOs that's on the top? A closed hospital,
Come
a
on, man.
closed failed hospital.
Come on, man. You know.
How can you do that?
You know.
A closed failed hospital. Wait a minute, it's closed, it's failed,
Mhm.
but
There's money even in in the closing.
the folks on top still making millions.
Still making millions, player. Yeah.
What?
Hurting on
Okay,
it.
all right. Here's how they broke this down. And I
Hurting
was
on
like, oh my goodness.
it. Yeah, buddy.
See, if that was me and you, that would be embezzlement.
I'm trying to tell you, boy. You be in
But
jail
to
right
them,
now.
it is what private equity.
Mhm.
Okay, here we
That's
go.
what they're- Yeah.
Wow.
A bunch of private equity firms bought up hospital chains, including private equity firm known as Cerberus, which came in and bought up this chain of struggling hospitals in Massachusetts. And they did so in conjunction with a well-known heart surgeon named Ralph De La Torre. And the idea was that this combination was going to revitalize, reshape, reinvigorate American healthcare. Ralph De La Torre spoke very passionately about his ideas for how you brought healthcare more efficiently to less well-off communities.
Healthcare is not really an exercise in public policy. We pretty much fundamentally agree that if we have the money, we'll give the healthcare to everybody who needs it.
And so the whole thing sounded really great on the surface. The inside story revealed that the hospital struggled from the very beginning. When a hospital has a ton of deferred maintenance, hasn't been invested in, things don't get better from there. So what ended up happening is this company called Medical Properties Trust had come along. They had decided that they could buy the land under hospitals and rent the land back to the hospitals. And that had the effect of allowing the owners of the hospitals to get their money out, to extract their money, even if the underlying business failed.
Did you catch that part? Because that part is super important. What Bethany is saying is that they sold the land underneath the hospital to another company called MPT, and they took that money and they paid themselves with it. Sometimes companies do that, and it's called a sale leaseback, and they use it to invest in the business to improve the underlying business. But that's not what happened in this case.
Some of the money was used to pay Cerberus a dividend. Cerberus's investors got over $700 million out of Steward. Another chunk of the money went to Ralph De La Torre, and he seems to have used a big chunk of that money to buy himself a yacht. So most of the business scandals I've covered have been bloodless. This is something worse because in healthcare, there is supposed to be another value that's at work. And I don't think anybody visualized people coming in to a hospital system and figuring out ways to make money that would result in the bankruptcy of the hospitals, thereby leaving people without access to health care and even resulting in death.
Now, this lady right here, right, is the one who actually busted Enron. Okay?
Yeah.
So she knew, she did her research and broke this thing down, right?
Yes, sir.
But guess what? It's all legal.
Yeah.
This
Oh,
one
yeah.
is all legal
It is.
until we do, you and me do it.
Yeah.
Embezzlement.
Yeah, it's embezzlement or self-aggrandizement. That's what that is.
Yeah, blood.
Yeah, they got a name for it, man.
Yeah, they got a name.
They got a name for it.
Yeah, bro.
Yeah.
Yeah.
But that's that. Like I said, man, they picked it apart. Now you gonna buy the land from under the goddamn building.
Yeah. And then you're gonna pay yourself
You're gonna lease it back to the folk. That man,
and
that's
lease it
cold.
back to the folks you just bought it.
That's cold blooded, man.
So then the hospital go bankrupt
Hmm.
because you done pulled all the value out,
Yep.
and then y'all go buy some more hospitals and do the same thing, the
It is
exact same thing.
the exact same thing, man. The
Mm.
exact same thing. Totally legal.
Now they called that back in the day predatory lending.
Yeah.
Okay.
But again, it always applies to different crop.
Yeah.
That's all I'm saying. So yeah, that's what you are. Um,
Wow. Wow.
it's cold blooded, man.
Cold blooded.
Um,
Cold blooded.
but this again, man, this is where you're serious. Right? When you get for profit in, they did it everything with
Mhm.
the Toys R Us. You pick what. Them cats will literally buy
Literally.
something that they know is getting ready to go under. They're
Right.
profitable for a minute, man, so they can start getting know how they're going to extract the funds out of it. The next thing you know, man, is off to the races. That thing gonna start bleeding, and they ain't gonna stop to bleed out.
Right.
Yeah,
Wow.
yeah, man.
Because McDonald's was like that.
Oh, yeah,
McDonald's was the number one real estate landowner in the world at one time.
in the world, man. Yeah, yeah, man.
Because that dude would buy, he would make them get the franchise,
Uh huh.
and then he would buy the land from up under them,
Hmm.
and then he would own the actual land and the franchise.
That's right. There. Kraft was smart. When it come down to that, yeah, the business model they set up.
Yeah.
But again, it's they always do this, man. Whereby you write the rules to benefit the game for you, and then when other folks get onto it, then you change the rules again. So it's all about that dynamic of what you're looking at, and
Right.
so it's kind of disheartening when you're seeing how folks have switched up this stuff at so many times at certain points, and they've done it, of course, through history. You can pinpoint where they got it from. But again, if another persuasion tries to do the exact same thing, maybe not into the degree that they do it, but then yeah, you're brought up on charge and everything else because you done messed up. So it's
Wow.
it's that part, bro. That part.
Wow.
That part. That part.
So it's almost like physician heal thyself.
That's what the bold man said, man. Yeah,
That's what he
yeah.
said, Doc.
Yeah, it was it. It was it.
Mm.
But it's now. I think, Jay, when we're looking at where we are in times, and you're looking at dictating things, you had a season where you have that 1%,
Mm-hmm.
2.5%, what number you gonna throw out there,
Right.
that is in control only because
Mm-hmm.
they've taken advantage of other people's misery.
Right.
And when someone is trying to survive, just get through
Mm-hmm.
the day,
Right.
they're not thinking about certain dynamics on that term because you don't have the leisure to think about that.
Right.
You're trying to put food on the table, keep the lights on, gas running.
Mm-hmm.
Well, when somebody all they can do, man, is sit back and think about how I'm gonna make more money. How can how can I pick this apart? If that's
Right.
all you do all day,
Mm-hmm.
and this is your work, this is your scheme, of course the conversation and lifestyle will be for you different
Right.
because you have that
Exactly.
leisure.
Exactly.
So the conversation got to be had on both sides. One is not a person doesn't want to progress their life, but the question
Mm-hmm.
becomes the systematic things that are there.
Yeah.
You don't have time to divulge in that kind of thing
Right.
to that level.
Mm-hmm.
And so you got kids now, and I hate to call them kids, but these college students now coming out saying they can't even find entry level jobs.
No. Mm-mm.
Come on now.
What's
So
that?
you can't
Mm.
find entry level jobs. I mean, and so now you got kids. I can call them kids. You have young adults,
Yes. Young adults.
young adults who can't find a job, which means you don't have insurance, or you're still living off your parents or whatnot, or you're forced to get these penny nanny jobs to try to make ends meet. And
Yeah.
so you got student loans on one side, you got trying to
Right.
make a living on the other side. So when you pulling all this stuff, man, and inflation tearing you up, and don't even pulling gas prices. Come on, man.
Yeah.
It is a situation where folks don't talk about the realities of life. We talk about it in textbook. When you tell
Yes.
somebody you need 6 months savings, huh?
Huh? How we gonna do that?
That right there, I got about 45 minutes saving. You about 6 months? 6 months? No,
6 months.
45 minutes. I got you, though. But after
Yeah.
45 minutes,
I'm done.
bets are on, player.
Yeah.
But we talk about things in textbook,
Mm-hmm.
and we cheapen the conversation when you do
Right.
that. This is not textbook. I don't care where you come from. And so, yeah, it's when you have folks that's their space. This is what they have been
Mm-hmm.
privied, and I do mean
Yeah.
privied
Yeah.
to be in. Then, yeah, the conversation is different, the walk is different, the
Mm-hmm.
experience is different.
Right.
Uh, and it's not that the pedigree is better. It's just that you've been privied to that
Privy.
space. Yeah,
Right. Right.
that's all that is. You've been privy
Right.
to that space.
Right. But you know what, brother? We got some young black farmers now
Hallelujah.
that are catching on, Doc. And they're saying,
Hallelujah.
okay, we're gonna take it from our ancestors, our elders,
Hmm.
and we're gonna walk this thing out.
Hallelujah.
Because we understand what went on and how it went down.
Hmm.
But it's our time, it's our turn right now. So let's first go to the black farmers, and you can see how some of their lands were lost and how they lost some of their lands. So
Hmm.
that's why you have such a small percentage of black farmers now, because they got frustrated and they just went to the city. They was like, forget this. We ain't going through
Right.
all this for a lifetime and not
Right.
not make anything. But let's go to the beautiful beam footage right here.
The family of Ernest Vines, a retired auto mechanic and former farmer, is among the many black families in the rural South who have lost land.
This house right here, this was my great-granddaddy and his wife. And this is where I was born at. I was born right there. I was born in 1947.
In the early 1900s, the Vines family purchased roughly 50 acres of land.
This deed was made on the 5th day of February, 1906. Oscar Vine was my granddaddy, and they purchased this land from the Dawson, and they approached it for $750.
They first started losing property in the late 1930s, when a white neighbor claimed 14 acres of their land. Vines' father tried to fight it in court.
This is my father right here, and everybody say he favored me. I know my father started going back to court in the 30s because of the land had been taken away from him. And so my oldest brother, he would tell me my father would go up to the courthouse and come back with tears in his eyes, saying what people done and how they could do things, how they could do things and get away with it. And he died unhappy with a heart attack. And I believe that's what really put a lot of stress on him.
Over the span of 70 years, both him and his father dealt with land disputes that cost the family half their property.
He went to Holy Hill, and he's not the only one in this area that happened to him. A lot of people ain't here to tell this. People might not think this is not real, but it is real. It was a color code thing. And that's why a lot of black farmers couldn't make it. And that's why a lot of them left and went to the city, because it was not fair what they were trying to do.
Unable to get a farmer's loan and keep up with court fees, Vines took a step back from farming in the early 1980s. Several years ago, him and his wife found a way to keep the land in use.
We donated to the church, and they're training the young generation how to farm and how to grow different things. I thank God that I fight it, and didn't let my father, and didn't let my mother, didn't let nobody down, didn't let God down. I think I did enough out here, so let some younger generation, young crowd go out and do what I used to try to do. Yeah.
All right.
My.
My. But this younger generation, some of them growing up,
I sure
and
thank
they
God for that.
learn from some of the mistakes.
Yeah.
Some of the mistakes that our forefathers made, or some of the elders made.
Mm-hmm.
Because with the black farmers, they look for loans from the government, things of that nature.
Mm-hmm.
But these young people say, you know what? Nah, I don't want no loan.
Mm-mm.
Just let me be able to handle what I can handle.
That right there, man. Yeah.
And here we go with the wonderful, beautiful beam footage of that.
The average age of American farmers is rising, but some black farming organizations are seeing a new generation of growers emerge. 26-year-old Kendrick Ransom is one of them. He runs an organic vegetable farm on family land, less than 15 miles from the Vines property.
I don't know many black farmers around here, especially not young farmers. I do have a couple elder farmers that come out to the farm and help me, give me some tips every now and then.
Back in 1925, black farmers in Edgecombe County outnumbered white farmers. But by 2017, the number of black farmers dropped by 99%.
Where y'all at? Ready for breakfast? When people think of a farmer, I believe they think of a poor peasant, you know, someone that's uneducated, just of the land, you know, just likes to get dirty. I don't really think people really grasp the significance of farming and the role of the farmer. What's up? You sleep good? I got into a bunch of trouble when I was younger, and I started driving dump trucks, and I started breeding dogs, and then later on became the agriculture piece. That was more so like an awakening for me, you know, it was more so of a calling. I got a lot of weird reactions. Folks just couldn't wrap their minds around it, and it was just like, farming? This guy wants to be a farmer? You was in the bathroom, baby. What's taking y'all so long? Come on. Yeah, it was very challenging times when we first got going out here. Come on, push the wagon, come on. Let's go, let's go, let's go. Didn't really have much to work with, had nothing at all, really. We got hoes, shovels, rakes. So that's pretty much it.
Why you do that?
Cause you taking too long.
I got big dinosaurs.
Oh, you did? It's very important that we learn how to survive and learn how to make use for what we got. Instead of just waiting around for grants or somebody to donate me or waiting on a handout, we make it work. I've never thought about taking out a loan. That's just something that I've been taught. My big brother told me stay away from loans. I'm familiar with the issues that black farmers face when they did take out loans and they were unable to pay them back. You know, you lose everything you got, and that's including your farm and your land for your family.
Yeah.
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 That's
now,
it.
he even raising the generation behind him now on the farm.
That's the key thing right there, young man. Yeah.
And the man said, we didn't have much, but we used what we got.
you got to, man. That's
You
all
got
you got.
to, brother. You got to.
Yeah.
Yeah, brother.
Yeah, man. So
Yeah.
it is a different time, and like brother 26 years old, praise God, I hope you stick with it.
Yes, sir.
But we need more cats like that,
More
man,
cats
to really
like
get
that.
out there, you know, take care of your air property, keep it in the family, you know,
Yep. Mhm.
learn how to repurpose it, da. But for God's sake, man, just keep
Yep.
the air property in the family.
In the
And
family.
God will work it out for you. Yeah, keep it
That's
in the
it.
family, man. Please.
That's it.
Please.
That's it.
Yeah.
And here's one more young person we got to bring up. One more young person. And she got a nice little idea that she came up with. And check this out.
I am the granddaughter of Brownie Lee McCullough, who was displaced from her land in Rock Hill, South Carolina as a child of the Great Migration. I am the granddaughter of Samuel Cornelius Smith, who was displaced from his land, fleeing from abuses of government in Haiti, and was fortunate enough to be the first returning generation of the grandchildren to find land again.
Over a decade ago, Leah Penniman and her husband bought 72 acres in rural Grafton to start Soulfire Farm, a community and teaching farm.
While some folks will call it Trump country, this is actually Mohican country. This is native territory, and it also has a long history being black land as well. Harriet Tubman built her farm not too far from here, as well as the Timbuktu black community and Rap Road black community. So it's not that we don't belong here, but we are definitely reclaiming space after many generations of being forced off of this land.
Last year, more than 1,000 urban and rural growers of color attended workshops at Soulfire on everything from organic gardening to food justice. Soulfire also launched what it calls a reparations map, where people with the means can locate farmers of color to donate to.
The reparations map is a people-to-people land and resource redistribution project that matches up black and brown farmers to folks with privilege who want to support their projects. 1, 2, 3, 4, 5, 10, 15, about 70. Okay, so we have currently around 70 entries into the reparations map. We do a lot of uprooting racism trainings for white-led organizations and in white spaces, and the reparations map is one of those what you can do kind of things that most people have the ability to engage with, at least at some level. These projects have received anything from, a few $1,000s to an entire parcel of land for their project so that they could go forward with their plans to feed the community. We're situating it as a remedy, one remedy to the long legacy of land theft and dispossession. I think when you frame it as charity or a fund, you're leaning into this idea of the worthy and benevolent donor doing the right thing for the community. But this is really about justice and fairness and correcting a past harm.
That's it. Right in the wrong, Doc.
Yeah, push the button.
Push the button. I know you ain't talking all shit. Yeah.
It's contagious, ain't it? It's contagious, ain't it?
Contagious, Doc. It's contagious.
Yeah, man. So
Yeah,
yeah,
Doc.
so fire, man. As I say right there, man, they're doing it. So yeah, you got to create your own mechanism for reparations, man, and
Yes,
that's
sir.
how you do it.
That's how you
That's
do
how
it,
you
man.
do it. Yeah, don't wait on nobody, man. Don't wait on nobody.
Yeah. Start asking
That's
that government y'all looking at.
No, man.
Mm-mm.
The good Lord gave you everything you need: a mind and the willingness to do. That's all you need, player.
That's it. Well, that's today's show on here on Uncommon Sense, where we
Go now.
explore the edges, brother, of reason, so that we can get
Yes,
to the
sir.
truth, because the truth will make you free. Jay Howard, along with Michael B. Wright Sr. See you next week.